Welcome to the program. Thanks for staying with us. Indeed, or rather, welcome to the interview now. Tonight on Newsnight, a strike amid a pandemic. Nurses and clinical officers on day 2 of the strike. Doctors set to go on strike by the 21st of December. Some of their key concerns include risk allowances and PPEs. Will government meet the demands of health workers? We want to get into that panel discussion now with a panel of doctors. In studio, we have Dr. Evanson Kamuri, who is the CEO of Kenyatta National Hospital. We also have Dr. Chibanzi Wachonda, Acting Secretary General, KMPDU. And joining us virtually is Dr. Anselem Kituku, CEC Health, Machakos County. There he is. I'll also be looking at some of your feedback on SMS 22422, and the hashtag is Newsnight. One person here says, let me see here what... okay, I think it's just slipped. They're really refreshing a lot. I'll look at them just now, and I will also look at a tweet by Dr. Alfred Mutua. But let me start by engaging Dr. Evanson Kamuri, who joins us. And you did have a chance to listen to what Dr. Chibanzi Wachonda had to say, talking about those 11 demands, which are non-negotiable, according to Dr. Chibanzi, and we ran through some of them. In your view, reasonable? In your view, implementable? What's your take as someone who runs the largest referral hospital in the region?
Well, thank you. And first, I want to say that it's sad that these are hard times, and I pass my condolences to the people we've lost, both health workers and Kenyans in general, for COVID. But secondly, I will also start by saying, if you read the Bible, I'm a believer. There is a Bible that says, Isaiah 1:18, let's listen together, says the Lord. Come, let's listen together. There must be a sense where we must come together. We must listen. We must listen to one another. We must talk. We cannot talk, all of us, at the same time. The demands from the union point of view, the demand from the government point of view, both have a ground. Everybody has a ground. However, we must also come to the reality that is we are in.
What is the reality in your
The reality we are in is that there are things you can be able to do, and there are things we are not able to do today. If, for example, at this moment in time, I go home and my daughter tells me I want a new shoe today, now, I may buy the shoe tomorrow, but I will tell them wait until tomorrow when the butter is open or when shops are open. There are some things we must learn to look at it. And I will tell you, Wahiga, from the way we have been handling COVID matters as the Kenyatta National Hospital, as a ministry, and as a government. And if you remember what I said earlier, we have taken a very clear-cut measure, and we have really dedicated, and as a government, we have really taken our energy. There is no step really we have not put in place. There are some demands, and even now, he will tell you, I'm sure he's here, he will talk to us. We have even been in negotiations. We have been talking. If matters of PPE, he talked about it. Shortage of PPE. Yes, there has been some sporadic elements of shortage of PPEs. But as my hospital, for example, in Kenyatta, we've not had a problem with PPEs because we have been trying to get PPEs available. And two, there has been something also called rational use of PPE. Rational use of PPE means when you are in some areas that are critical, for example, those people who are in IDU, in Bagavi, the infectious disease unit in IDU, those people have PPEs. And we have even taken the media people to see how they change PPEs there. There are those people who are not in critical areas. So, which means they don't have to wear the Apollo 8. When I always say Apollo 8, if you have seen how people went to the moon, that's what we call the full PPE gear. You cannot, even those people who are, for example, me, I'm a dermatologist. I'm a doctor by profession. I'm a dermatologist. When I am not seeing those COVID patients, the only thing I need to do is to protect myself, just like you and me. When we are out in the streets, we are supposed to protect ourselves by using the masks. What am I saying? I'm saying that there are measures we have put. There are measures that are possible. I agree with Wachonda. Everybody should be covered. Everybody should be covered.
This is one of the demands.
Yes, that's one of the demands. But as we cover, we must look at, we are covering at what level? At what level? I'm not saying we should divide Kenyans into different levels, but I'm saying, for example, the government, all civil servants have an enhanced cover. That's one. And I agree, the doctors, what they're asking, and we have been in negotiations. We have been in negotiations on how we will cover a number of them. And even the short-term, even as much as last week, the short-term workers who have been employed recently, yeah, we are in the process of discussing on how they should also be included. And let me tell you something, Wahinya. As much as the union may think this is the time, the government is doing this because of their demand. I will tell you, and I will go back to April. April, when the COVID came, the national committee, the National Implementation, Communication and Development for Cabinet Committee discussed some of these measures in April and put the issues one by one, how they will protect the health workers, how they will put covers for health workers, how will they compensate the health workers. We are talking about April. We are now in December. These are things the government has been doing. And if you want to, you can find out whether that is what has been happening. What I'm trying to say is that some of these things, it's not things you can do overnight. Okay,
I want to get a quick response because there's a lot you've said and a lot that you brought to this table from Dr. Wachonda. Before we speak county matters now with Dr. Anset, who is listening in. Go ahead, Dr. Wachonda.
Thank you, Trevor.
Just to say that Wahiga, but carry on.
Sorry, I'm used to Trevor.
No problem.
Sorry.
No problem.
Wahiga.
He's my good friend. Carry on.
I hear my senior colleague. And let me say this. There's no person, I'd say this with confidence, who's well versed with PPEs right now than myself. And I'm saying it from a point that I've worked in the COVID fund. We've gone around this country in factories to ensure that the locally manufactured PPEs are of good quality. Pro bono, no payment. And the PPEs he's talking about in the IDU and in 68 designated COVID-19 facilities in this country are out of the initiative of the Kenya Emergency COVID-19 Fund. That is an initiative of the government. We have supported it as a union. In April, May, we came out and said, as a union, we will not engage in industrial action. We've tried to engage, and I think I was here and I put that forth. Out of the 68 designated COVID-19 facilities, level 2 facilities, level 3 facilities in the counties, and even in the parastatals, there was, at some point, if you remember clearly, KNH had been hit with that issue of shortage of PPEs, which to some extent they resolved, yes. But PPE shortage is real. It is not imaginary.
And it is real today.
It is. What is the WHO recommendation? And I told you I'm very, very, very well versed. Recommendation of level of PPEs, depending on where you are in the hospital. You have level 3, level 2, and level 1. Depending on the facility where you're working. If you're in the IDU, what he has just said, in the COVID center, you put on the level 3, which is a full kit PPE. Level 2, because the disease is spread to the eyes, nose, and the mouth. Goggles, masks, and because of spillage, which is a risk, which we saw in the US when nurses, doctors were putting on nylons. Surgical gowns, these are not expensive things. These are things that are available in the country. And the COVID situation across the globe has exposed healthcare systems and systems. But we are also dealing with a chronic issue in the country. The issue of the KEMSA PPEs that are still stuck up until now, and that you have confirmed, it's public knowledge that they are not, there's no written directive to release those PPEs, is an issue of corruption. The issues of employment and labor relations, and I told you earlier, very well trained postgraduate certification internationally on these matters, is an issue of neoliberal policies that inform and trickle down to the type of employment contract terms that we are seeing. In KNH, over 67 doctors employed on 6 months contract in June.
This is what? KNH?
Kenyatta National Hospital.
Okay.
Earning
and I'll give him a chance
120,000 shillings per month. They're working with the other colleagues who are earning more than that. That in employment and labor relations is a problem. He will respond to it, but it's a problem because they're doing the same work. There's no difference. Why are you paying them less? The practical example of these contract terms and employment terms is what we witnessed yesterday. And that story is very sad. And personally, I've been involved in this case. I was in Kenyatta University Teaching and Referral Hospital yesterday till 8 p.m. And I spoke, and I really thank the acting CEO, Dr. Njom, and the acting clinical director, Dr. Anthony Kamau, because they understood and said, this is our colleague, we will see what we can do. Even today, it's a matter that I've raised, and the ministry has to cater, one, for all medical costs, and two, compensation to the family, because as I told you, these are employment and labor relations matters. So these are real and practical problems.
Okay.
Practical problems that have resulted in loss of lives, and so you're risking more people. So we're just trying to help the country here. We don't want to lose more healthcare workers. We have a very serious shortage. We're trying to help the countries. But if the concerned parties will dismiss unions, will not want to engage meaningfully, we've been very reasonable for 8 months, and we've thanked the president publicly. I've stood myself and said it publicly, that we thank the president for taking this initiative, the COVID fund. We've done it.
Okay.
So, people who have been tasked with responsibility in ministries and the Council of Governors must take responsibility and take care of the welfare, occupational safety and health of all frontline healthcare workers.
Okay, hold on there. Dr. I want you to come in shortly, but first let me also introduce Dr. Anselem Kituku, CEC Health, Machakos County. And Dr. before you speak, let me read a tweet that was posted yesterday by your boss, the governor of Machakos County, Dr. Alfred Mutua. Let's put that up. And of course, our condolences once again to the family of Dr. Stephen Mogusu, who lost his life to COVID-19. Dr. Alfred Mutua tweeted, sad to learn of the passing of Dr. Stephen Mogusu, attached to the Machakos by national government's UHC program and pay. Improper that his employer, national government, had not paid him for months. Doctors employed by my government have no salary arrears, receive allowances, and all have insurance cover. And there was quite some blowback to this online. Let me begin. We called the governor, but in his place, Dr. Anselem Kituku, CEC Health. Just explain to us how this works. For Kenyans out there who may not understand this arrangement, employed by national government, seconded to the counties, who takes responsibility, who pays who? Talk to us about that, Dr.
Yeah, thank you, Waiga. Good evening, Dr. Wachonda and Dr. Kamuri. One, I want to say that I knew Dr. Stephen as a person because when he came to Machakos, he reported and came to my office and I introduced him to our HR and he started working with us. So first, I want really to pass my condolences to his family, his wife, and all his colleagues. I've been in touch with his wife since when he got sick. We've been discussing how we can step in and help. At some point, of course, I was brought to attention of the issue by the Kenya Medical Association and also the Doctors Union. And we were discussing when he was still in a private facility in Utawala. We are trying to see how we can transfer him to Machakos COVID-19 isolation facility for treatment. Unfortunately, that did not happen, and I really pass my condolences. You've asked me how this works, and the thing is, let's appreciate that we're in a pandemic. And what the national government did to supplement the counties is the national government did what a responsible government should do. They hired on short-term contracts healthcare workers to come and supplement what the counties have done, what matters a response to COVID-19. And that's how these doctors and clinical officers and nurses came into being. And of course, we appreciate that payroll is a process which sometimes can take some time to finalize. And so basically, these are healthcare workers who are recruited by national government as a mitigation measure to support counties as we prepared and we tackled the COVID-19 epidemic. Yes.
Okay, because when the governor posted that tweet, officials of KMPD, okay, there was quite some back and forth there, some of which is not appropriate for general viewing on national TV. But nevertheless, there were concerns by medical workers that Machakos County had not been fully honest in this discussion. I can also give you a chance to respond to that. I'm sure you saw many of the questions that came in from other medical professionals as a response to that tweet.
Yeah, thank you, Waiga. The thing is, first, I would want to urge Dr. Wachonda to kindly urge his members to exercise decorum when we exchange on social media and elsewhere, because the public follows these things, and when doctors we are seen to be using very uncouth words on leaders, it reflects very badly on us. And you can imagine when a patient comes to see you and to be assisted, and this is the same doctor who was throwing uncleanable words to leaders, it is wrong. But I've said the facts they are, and of course, as I'm sure you also seen on social media the payslip which was being shared around, and that's a fact. We really feel it's unfortunate. You can imagine we are discussing a colleague who has a family who are grieving, and I would really want us not to dwell so much on that, because we may be causing more injury to them. But as you've seen, that's the fact of the matter, that these healthcare workers were recruited on short-term contracts by a responsible national government to support counties. And we receive them in the counties. They have been assisting us as a stopgap mitigation measure, and that's a fact. And again, by the second part of what my boss tweeted is a fact, that in Machakos County, we pay our healthcare workers, including myself, on time. Already, all our healthcare workers have received their November salaries, and I'm sure the December ones are being processed.
Okay.
Again, yes.
I'm interrupting you just to ask you one quick question. One tweet that's come in, clarify this for us. Mwaura asked Dr. Kituku, why is Machakos County employing degree or diploma nurses as certificate nurses under UHC? He's aware we haven't received our salaries for the last 3 months, no risk allowance, COVID allowance. Is there any truth to that?
Again, Maura, that's a good question, and I need to clarify. It's true, under the UHC program, which, remember, Machakos County was one of the pilot counties, and then now the UHC is being rolled out across all the 47 counties. And adverts went out. Of course, intergovernmental discussions were held, and the money is, because again, let's remember, UHC is one of the big four programs for His Excellency the President. And the funding for those extra healthcare workers to make a UHC a success are actually coming from the national government. And obviously, budget issues come in. And therefore, after deliberations, it was decided what kind of cadre of healthcare workers to be engaged. For example, let's say like for nurses.
Okay.
A certain number of diploma nurses. But because of the problem we have in this country, we have so many degree holders who are jobless. When those adverts went out, actually even degree holders applied, and they say they are ready to be paid the amount which was in the adverts for diploma holders. And that's the correct position. And let's again remember that for any employment is a contract, and someone signs for what they really want to get. It's not the real thing, but we have a serious unemployment problem in this country, and therefore when opportunities come, even for certificates, you find degree holders applying, and they are given a chance.
Okay, hold it there, sir. I allow the other guests to weigh in on what you've said. But Dr. Evans Kamuri, obviously a direct question to you from Evanson Wachonda about the status of some of the doctors within your institution. I want you to start from there before you
let me first, before I start from there, before I forget. First, we must be honest. We must be honest with ourselves. And two, we must remove the issue of politics first. Either politics at national level, politics at union level. We must be honest with the statements that come from our mouth. The first thing I will say is about our colleague who passed on. And I am a witness. In fact, I was there when the minister was giving a directive that person will not pay. And I would want the union to clarify that they were not given that statement that the government, and when we talk, when the minister talks, literally, the government has said it will take care of that bill in that hospital, and that is factual. So let us not emotionalize the element of a colleague who has passed on, and we say that the government is not taking charge. Let us be honest. The second bit I want to explain also is the issue of payment. The issue of payment of salaries. We have at this point in time, we have engaged up to 10,000 health workers in concept of UHC. And when we engage them, first we are engaging them on a short-term contracts. When we engage on short-term contract, Wahinya, there are several things government does as procedural. One, we cannot pay you because we have to generate something called a personal number. Because for you to be paid, you need to be put in a system called IPPD. And the IPPD, for you to be set in an IPPD, you must put, first, we give you a form, a platform, you log in your information, which we generate for you a password. We send to you. When we send you that password, you key in your information, where you come from, your qualification, upload your photo, your passport, or your ID. After you do that, you send the information back. And this is a process that takes 1 or 2 months. And even when we used to be employed long time ago, even before we had the ICT platform, we used to take even 3 months for people to be paid.
Before the first salary hits the account. Yes,
those were even those days, 25 years ago when we got employed. But what I'm saying, this is a process. Because if we don't do that again, you know Kenyans and their habits. Some people will go in, start be paid, you will start saying about ghost workers, and that's why you will see the process takes like 2-3 months. The minimum of newly employed, new employees will take 3 months, especially for the government. Kenyatta is different.
This is standard practice, it sounds like. And how does it work? Because for those 3 months, you will obviously have some very aggrieved employees.
Now, and that's what the government used to do. That's why we used to have an advance. And depending on how fast, like now this block of doctors, they were I think 177, maybe he will tell me, I can't remember the figure, the actual, only 116 returned, fed the normal key persons. But this is a process that is ongoing. For Kenyatta now, where I come in, when I say I want to employ because I have a shortage, and we were among the people who got the benefit of that pack of UHC. And we said, please give us some workers. And this is the budget. We were given, please engage the workers on this level and this money. And that's why I engaged. You see, we are running a willing buyer, willing seller. If I have a job of a house help, if I want somebody to come for a house help in my house, and I tell you, please, I will be paying you 20,000. Do you want to take it or not? When you come and say, okay, what will I be doing? And I tell you 1, 2, 3, then you say, that's okay. You cannot say, now when you have come, then when you have come in and I've given you a short contract for 3 months, then when you come in, you start telling me now, from now, I want to be paid the way you are paying this watchman who has been here for 5 years. You understand? Because whether we are doing the same job or not, you cannot come and tell me now. Because I gave you the job voluntarily, because I wanted you to cover that gap. Wachonda here now comes and tells me, now, these people, you must pay them. We must learn that we also do something called procurement plans. We also employ through an establishment and a budget. So you cannot come in between and tell me this one who is working like this one. And the other option, Wahiga, was to tell them, okay, I will only be employing you. Come for 2 hours, I pay you for 2 hours, and you leave. But because we also want to be factual, and that's why we have developed a package. And this package did not, the 120 we are paying, Wahiga, we did not start when COVID started. This is something we have been doing to cover up the employment gap that is there.
Dr. Kamuri, help me understand this. It's 2020, actually nearly 2021, when RTGS transactions take 2 to 3 hours to hit people's accounts.
Yep.
You're telling me in 2020 that even if one of those doctors was to key in all the information to this IPPD on week 1,
yes,
it would still take 2 to 3 months?
No. But I will tell you the same thing. If I send you a WhatsApp, Wahiga, when are we meeting? And you don't reply today, and we are supposed to meet today, will we meet today? And this is a bit, and this is a bit we need to understand.
For those who don't feel it makes sense, but for those who do, it sounds like the system is quite inefficient.
No, and that's why I'm saying, and I want people to move with us, to know that actually systems, when you actually do system in a haste, most of the time, there is a lot of corruption. This is something, and even this is something that has been established by Public Service Commission. This is something that it is not a Ministry of Health affair. This is an inter-ministerial affair. And what I'm trying to tell you is that it is everybody. It's not one party that we will delay people's salary. It is a joint. I do, you do your part. I do, you do your part. However, we even have an option. If somebody comes and says, okay, you have employed me, and that's why we have been having manual advance payment. These are things that happen in the ministry. It's not now, and these are not things that are happening now because of COVID. And I will tell you, Wahiga, the systems have not stopped because of COVID. We still have other problems. We still have malaria. I still have a hospital to run. I still have diabetes. So we must learn that things must continue, and we must think even tomorrow after COVID is over, because COVID will not last forever.
That last statement is very good to hear. Dr. Wachonda, you've been listening. You can respond now.
Waiga, the opening statement of Daktari shows the attitude of government.
Refresh our viewers in case anyone missed it. What's the reminder statement?
He said politics, he said unions. You saw the attitude. And Daktari himself, he has told me some statements that I wouldn't want to say here when I call him about an issue affecting doctors in Othaya Hospital. He told me to tell my doctors to go to hell. That's what he did.
Okay.
And that's the attitude. And these issues are very simple issues. Waiga. So in essence, what I'm saying is this. The issue of payment for months is not new to this government. You can blame the doctors, you can blame whoever, but it is not a new thing. If you were to ask all doctors in government today, even internship, I remember I did internship under the ministry, and we had to wait for 6 months, and we had to demonstrate for us to be paid. So it's that reason should not even hold water. But you know what really hurts? Or what really tells you that some people don't care? In July, the same ministry diverted 1 billion for human resources for health to procuring testing kits. And those doctors had been employed were about to be employed. And this was in record in the National Assembly.
Yeah, I was just about to ask where you, to verify that.
It's on record in the National Assembly. It can be verified. So you see, we are not talking about issues that are not real. It's the attitude. We've put issues on the table. There's nothing personal here. These are matters that are supposed to be handled because, and I'll remind everyone, including Kenyans, employment and labor issues affect families. When a doctor is not able to cater for their own needs, you cannot come and tell us about processes that are very doable in a short time. We asked this in the first meeting we had on the 16th to the ministry. Did you conduct what used to be called induction previously to those you have employed? And the answer was no. So you can't abandon processes that used to work earlier in government. And Daktari went through it. Civil service induction. But what happened? No one's doing that. And then you come and blame doctors. And you know the worst and the painful thing is you are a custodian of information of your employees. You find ways of sending it out to social media. When?
What is referring to specifically?
There was a payslip. There's been a payslip going around.
You're sure? Okay.
The custodian, the only two people with access to that payslip. The deceased, through logging, getting it, or the custodian, which is the Ministry of Health.
Not a hacker.
And the first person who came out with that payslip was Senator Ledama Olekina. And he said it on KTN News last evening. I have been given this by the Ministry of Health. That is a responsibility. We cannot, and you cannot tell us how to mourn our doctors. And I'll also respond to Dr. Anselem here. Sorry to say, our political leaders are rubbing salt into the wound. When doctors, healthcare workers are mourning, be responsible with your statements. Do not rub it. And the governor, Alfred Mutua, has been doing it severally, even on this platform here. Doctors are selfish. This is blackmail.
Okay, he's not here.
I know, but Anset is here holding brief for him. And I'm saying it because I even have it when he was here last week. And he said that. And I called the Council of Governors. Told them, please talk to your governors. Do not trivialize this. Healthcare workers are mourning. Thank you.
Well, before you stop, let me clarify something so that I can be quoted.
Then I'll allow Dr. Ansett, because he's also
I want to be quoted so that Secretary General here doesn't misquote me. I have said, and I will say it now that I know I'm on national TV, I have said it that I don't want the Kenyan health to be handled politically, either at political level, at national level, or at union level. That's what I've said, and I will not back, because I still believe the health of Kenyan is more important than anything we can talk about here, even if we are to stay. So we will not relent by saying, and as a government, I work for the government and I represent the government. The government takes care and is very serious about the health of Kenyan. So let's not politicize it.
Who is politicizing the
That's
issue?
What I wanted to clarify to him. That is the statement I told him, that let us look at matters in a platform where we are engaging, not looking at, he said that we have an attitude as a government. You see, that's already a bad allegation, because we cannot have an attitude. And the second thing I want to clarify, I cannot tell doctors to go to hell. Then I will also be going to hell, because I'm a doctor as well. How can I tell my doctors who I'm governing in Nyeri that they go to hell? How would I say that, Wahiga?
So
and then I will be going to hell as well, which I think, Wachonda, when we leave here, you should apologize.
Daktari, I will not apologize, because on that day you called me, I called you, and you said it, and you remember. So I will not apologize for that, Wahiga. He said it.
But you say that... No, I don't know. Unless we got
anyway,
the call, we can't go into that.
It is my word against him. So, but we will. When he leaves here, I want him to communicate with my doctors in Nyeri and my staff in Odaya and find now whether the issues he is talking about are there. For us, and I will tell you, I believe on working on a straight line, because I will be judged. And I stand here saying, I stand with what I believe in. And as long as I'm running the hospital, I will run it with what I know that is prescribed by law. And that's why I will say, even the engagement of my workers, we discuss. And if you agree, I'll give you a salary of 120. Even if, and it's documented and is approved by the board. Wahinya, I cannot, even if he comes, the only thing then I will do, if worse comes to us, then I will tell them, then let's part way. Let's look for other amicable solution. And that's what, as a government, we will do.
And one of your biggest concerns tonight is that KMPDU is politicizing?
No. I'm saying, and I'm sorry.
I want to get that on record. Because you've twice or thrice talked about politicization of this issue, I want to hear from who?
I have said, and I will say it again here. Even when we are talking some issues, when you are talking that you don't want to take this, you can only take this, that's also politics. When Wachonda comes here as the Secretary General and says, we will go on strike, yeah? One, he's a union leader. So I can tell you for a fact, he's also a politician. But what I will tell him now, and I'm begging him, whether it is the right time to say it is good, and that's why I said, for me, I always give him a forum. Let's discuss. And this is what I'm saying even now. As a government, or as a CEO of Kenyatta, even now, my doors are open. I know the PS doors are open, the Cabinet Secretary, the doors are open. We must get an amicable way of exiting some of these problems. And If the government is also listening, you as a union also, you should also sit down and say, this cannot work this month. Let us push it to 3-4 months, like that, so that all Kenyans are safe. That's all what we are talking about.
Dr. Anselem, let me also bring you in. Wachonda, hang on. Dr. Anselem, let me also bring you in. Governors, your governor, accused of politicizing the matter of the doctors' strike. A strike we know is set to begin on the 21st of December, with the nurses and other officers also still on strike. I want to give you a chance to respond to that right now, that this issue has now become politicized and being used for political fodder.
Yeah, one I wanted to urge Dr. Wachonda to calm down, because, we don't really need to sensationalize things. Fact of the matter is you have branches, including the Lower Eastern branch, where Machakos. And it's also important, Daktari branches, because we've been engaging Lower Eastern branch officials. We have virtually no issues at the Lower Eastern and especially for Machakos County. The issue of our late colleague, again, kindly note, the KMA, Dr. Kigondo, contacted me on the 2nd of December. Concerning Daktari, and we discussed at length. He even gave me Daktari's spouse contact, which I used. I talked to Daktari's wife. Later on the following day, I also talked to union officials, specifically Dr. Thuranira, and we discussed all the issues, and I offered we bring an ambulance to that private facility in Maradaima. In Utawala, to take Daktari to Machakos, one of our facilities, for free treatment. So now when you start saying that we don't care, we don't do what, let's be fair. Let's remember that we took an oath to protect human lives. The truth is free. So we don't really need to censor things. And really, I'm surprised you are saying that my governor has been unfair to doctors. I can tell you without fear that when you look at health in Machakos, among counties have done very well on all these issues, taking care, ensuring that even CPS, we are up to date. I'm sure if you talk to the Lower Eastern branch, we inform you that we are so much on course. In fact, we are almost achieving 100% of the CBA implementation. We've done so many things, including that setting up even now for COVID-19 and dedicated treatment facility, Kanguro Level 4 Hospital, COVID-19 isolation facility, with the self-contained rooms for healthcare workers. Again, if you check since the devolution, Machakos County has employed the highest number of healthcare workers, including doctors. Machakos County again has been releasing the highest number of doctors to go for postgraduate training. You have the records. Actually, if you check, right now we have almost 80 doctors in training. And surely then you turn around and start saying, oh, the governor is not respecting doctors, is not listening to you. That's not being fair. And I would want to urge, let's remember, we live in a country which things are not ideal, but have to deal with what is real. But with all those challenges we've gone beyond what is doable. And as much as I'm talking about Machakos, yes, I can also talk about the other counties. I can tell you for a fact, counties have done so well health-wise. And sometimes the user is the best person you can get this information from.
I want to interrupt you to get specifics. Sorry, there's a bit of feedback. Good, we've got that sorted. Specifics on what you mean by doing so well. And let's use Machakos County, for example. Right now, are there any arrears that you owe your doctors? I see a tweet here, someone saying, I practice in Machakos. We just got paid yesterday. It's been like that for the longest. Delays. Give me numbers here. You're saying counties are doing well. Let's take Machakos. Are there any arrears to your doctors now, or are there late payments that were made?
I can tell you there are no arrears. And again, sometimes delays can be the bank the person is. I can confirm to you that our healthcare workers started getting their salaries from last week on Friday.
For the month
and surely, for the month of November. So unless someone wants to say 2 or 3 days is a delay, that's not being fair. because surely, I think sometimes what happens, and well, say now sometimes human beings, the more you do good things for them, the more they start demanding until probably they want to eat you. Because surely today is on the 8th, and someone is saying they received their salary yesterday, yet others got on Friday. And in all fairness, knowing the situation where we are in, if you get last month's salary by the 5th, the 6th of the month, is that really a delay we should really make and call for a strike?
Fair enough. I think you've responded. Also, tell me this before I allow Chibanzi also to come in, and Dr. Kamuri. In terms of PPEs, would you say that doctors under the county have sufficient access to PPEs for daily use?
Waiga, sorry, I did not get your question.
Thank you for calling me a doctor.
I
Not
think
yet.
Some connection issue from your end.
Not yet, but I'm asking you, since you've talked about arrears and salaries of doctors, let's talk about...
The voice is gone.
Oh, the voice is gone. Okay, let's try and get that.
I can't get here.
Okay, we're going to sort that out shortly, and I'll come back to you on that. Chibanzi, you had wanted to come in and respond to what I think Dr. Kamuri had to say before I got into this discussion. I can give you a chance to do so now. And basically tell us how do we proceed from here? Because, from what I'm hearing in this conversation, 21st is not far off, and many patients and some of the messages are coming in now. What are we going to do as patients now?
Waiga, I told you I'm very well trained on these matters.
And no one has disputed that.
Yeah.
I think you've even
and why am I insisting this? Whatever he's saying will not solve the problem. What will solve the problem? Let us sit. Let us look at the matters, focus on the matters, and we'll get to an agreement. And I'm really glad that the National Assembly Health Committee and the Senate Health Committees have taken that role to actually bring the sides together. But if the government side boycotts again, then that's a show of bad faith. You just don't want to engage. We can find a solution, focus on the issues. There's no politics. Unions don't play. It's an insult to trade unions and the labor movement to say that labor movement plays politics. It's a serious insult. He might not know it because he's a doctor like me, but now this space, I have that level of experience and knowledge. And if you go to the Constitution, Article 41, if you go to the Labor Relations Act, trade unions are part of it. That's why we have the International Labour Organization. That's why we have organizations like the Public Services International supporting the labor movement. So trade unions don't engage in politics the way they're saying. If the matters are real, and this country has seen how many doctors have died, how many doctors have gotten sick, focus on the issues and let's resolve the issues. Thank you.
Okay. I have some specifics for you, Dr. Kamuri, which I asked to the CEC Machakos. Let's understand what's happening at your hospital. First of all, any arrears pending for doctors?
No.
None whatsoever. If we
the
were
answer is very simple, no.
Okay. Medical cover. What sort of medical cover do the doctors at KNH have?
By the way, I will tell you, Kenyatta National Hospital has the most comprehensive, and if you must know, all my staff.
And I want you to, nurses, clinical officers.
When I say all my staff, Wahiga, from security who receives you at the door, to the nurse who attends to you, to the doctor who sorts your problem, and to the person, God forbid, even the person who is at the mortuary on your exit, if you have to go vertically. All my staffs are comprehensively covered. And even when they fall sick, we don't admit them in the general ward. We actually admit them in the private wing. And our limit has no limit. And if the event that we have a problem that cannot be solved locally, I actually take them abroad if it's a problem that we can solve.
You will fund their treatment?
That is the arrangement we have with the hospital, with the board of management, and that's what has been there. That's what has been happening. However, even the government is now doing, we have the public service enhanced cover for NHIF, and that's why I said earlier, even for the ones we have employed for UHC, at the moment as we speak, The process of giving them a medical cover is in the process. And that's what must be done. And as Wachonda has said, let me tell you, there is nobody who has bad faith. And even now, and I will tell you, Wahiga, COVID will come like any other pandemic and go. But what we are discussing between him and me and the ministry and even my colleague in Moi, Dr. Aruasa there, what we are discussing now is healthy. Because after the pandemic, we want the health systems better. And that's why we are having a dialogue. Even this issue of having medical cover, it is good that we are addressing it now so that it can be enhanced. And that's why I've said all of us are approaching the table with good faith. And that's why I said, and I quoted when we started, Isaiah 1:18. I will repeat again. Come, let's reason together. The Bible says
some of the doctors who are texting us tonight are asking you, as in the position that you hold, to reason with them on why you can't make all their doctors permanent and pensionable. That the contract some are describing it as substandard.
Again,
it is not working for them in the midst of a pandemic.
That's what I was explaining to you, Wahiga. We must also, as doctors, let's not just know how to remove an appendix. We must learn how systems work. And for systems to work, you must have something called establishment. For me, even now, I'm a dermatologist, but my establishment says I can only employ 5 dermatologists. So even if I have 10 dermatologists there, I cannot. I must account for each doctor and the activity they do for that hospital. So the reason why we employed this one, extraordinary times call for extraordinary measures. We did not have a budget. We were not anticipating that corona will come. So we engage these extra doctors so that they can cover that burden. We don't know how long COVID will take. But then that's why we have accumulated. And this money we are paying, this short term, these are short-term contracts. Even the contract we are giving, we are paying them short-term contract. I don't want to pay them if I don't have the money. And I also want to give them an opportunity because it's a willing person. I advertised how many people want to cover this COVID period. People came and I told them these are the conditions for employment. Please take. And they took. So you cannot take, Wahinya, you must be very dishonest. If you now, when you take, then you start telling me now, I want to be paid this. And what I will do next, and it's not being unfair, I will just again advertise and get somebody else who want to do the same job.
What would it take, and this is in reference from something that you just said, before I allow Dr. Wachonda, I need to also ask him a question. You spoke about medical cover for your employees. Is it in effect? Is it being affected? Are you in the process, or do all of them have medical cover as we speak?
My doctors?
Yes, your doctors, your clinical officers.
Yes.
Today as we speak, on this 8th day of December, all of them.
Kenyatta, the ones who are in Kenyatta?
Yes.
Yes, they have.
Plus all other cadres of staff.
I have just told you, my friend, either you are interrogating Wahinya, but
yes.
I've just told
seeking
you.
Clarification.
I have been in Kenyatta for the last 30 years. I have benefited as a doctor from a junior officer, and now I'm still a doctor. I'm still a practicing doctor, despite me running the hospital. But what I'm telling you is that anybody who is employed by Kenyatta, we have very clear terms of employment, and that is what it is. And that's why we hope and pray that it will be a going concern, or it will happen the same way tomorrow. And even the next CEO will come. It is not me who has created that. It's a system that exists.
Okay.
And that's why we go back and say we are wishing that we will now, as a government, we will keep replicating some of these good practices so that they can, in future, even after Corona, we want systems to work the way my system is working in Kenyatta.
The way your system is working. Okay, that's an interesting point, because I now want to bring it. Do we still have Dr. Ansent? Can he? Okay.
Yes, I'm on.
Good. My question to you had been: you've defended your rate of payment of doctors, that they're up to date in terms of payment and the delays. Let's talk about PPEs. Do your medical workers have access to sufficient PPEs tonight in COVID isolation centers and across board, those under the county?
Yes, my healthcare workers have adequate PPEs, and this we've done through using county funds, using the COVID-19 support, using support from partners like the Equity Bank Foundation, AMREF, and recently we even were the CSL, the Dr. Masimangang, from Baburi Semi in Athi River. So I can tell you without fear that my doctors, my healthcare workers, including myself, have adequate PPEs.
What do you mean by adequate? On this show, we're trying to get specifics. I've just taken Dr. Kamuri through specifics. Walk us through 1, 2, 3. What do you mean by adequate? How many can they access per day, for example? How many hours do they wear the same PPE equipment, for example?
Basically, going by what even Dr. Wachonda has mentioned, we have the 3 levels. It all depends on the exposure risk. And again, these are consumables. So you can't say my healthcare workers get, if it's a surgical mask, you can't say they get 2 whichever number. It depends on the usage. So there are those who get 2 per day. There are those who use more than 10, even others more than 20. So all those are, and remember, these are consumables, which are routinely being used and replenished. So we can't really say, I can't really tell you that my healthcare workers get X number of PPEs per day. But as I've said, Lower Eastern Kenya as a union, doctors union, and we've walked through with them. They actually, before I forget, I also need to thank the union because the Lower Eastern branch actually also supported us with some PPEs, which I think was also from the national union. Actually has been visiting our hospitals, our facilities, we've taken them to our stores, and they have confirmed we have adequate PPEs. But as I've said, these are consumables. The quantities which are there today morning are not the same quantities which are there today, but we continuously replenish them.
Okay. Dr. Wachonda here with me in studio. When was the last time you spoke with government directly on this strike? National government, county government?
Government is an amorphous body, but we engage. We keep engaging.
Have you engaged this last week, this week?
Yeah,
especially on matters to do with this strike.
I do follow up, and let me say that, and also thank the CSL. I engaged him on Sunday regarding the doctor, and he was resourceful. So we are engaging, and that's what I'm saying. There's nothing personal here. These are issues that need to be resolved. And I listened to my colleague Dr. Anselem, and he's talking about sensationalization of issues. I'm not sensationalizing issues here. I'm just articulating issues affecting doctors who are workers of this country. And I'll say this. We are helping the government. If you listen to us clearly, we are saying put in measures to stop or reduce the infection of healthcare workers, the mortalities of healthcare workers. We are talking about, and Dr. Kamuri has actually alluded to the fact that he has shortages in his hospital by saying how he engages on locum, on contract. He's trying to cover the gaps. And there's nothing that stops the government today from doing a projection on HR, investment in human resources. There's nothing that stops government from doing that. Yes, the budgetary issues, but can the government come and commit and say, the way TSC does it perfectly well, 10,000 teachers here now, they're all on the same terms because it's one centralized body. But what is the problem in health? Devolution, the decentralization of healthcare. More so on the human resources for health.
Is it fair?
Let me say,
is it fair to just say devolution alone? Because many say even prior to devolution,
yes, we had issues.
We had Abuja Declaration. We
had issues. I do not disagree. But is it practical from the experiences we have in the counties? And I listened to my colleague here, Dr. Anselem, and he knows deep down that there are issues affecting human resources for health in this country in the context of devolution. We have created a structural problem that has for the first time resulted in a serious shortage and a pool of doctors out of employment. And we had 2 of them speak out today. A doctor goes for internship, finishes internship or completes the internship, and they're left. They have nowhere to engage. I know of these doctors, because equally I've supervised them in the internship, who are seated home, some with their babies, Others have looked for other things to do simply because there is no centralized formula of engagement of doctors. Our doctor-to-patient ratio is very wanting. Our specialist number compared to the entire population is very wanting. So we are trying to help government. Government needs to listen. And just to say that, you know what he's describing here, and I told you, is simply the policies that we have on employment and labor relations. If the policies do not align well, is when you realize that then now you have created a pool of what you're calling cheap labor. So now healthcare workers in this country have now been reduced to that. And yet we say health is key. And it's not just health, by the way. These are policies that need to be done because this now is affecting the entire country. Unemployment is real. And it's because of these policies. And I said that, you know, we have chronic problems in the country. These chronic problems have now been exposed and made worse by the COVID-19 situation. And it's not just in this country. It's across the globe. Universal social protection is a global thing that has now been embarked on. And Kenya is one of the countries that is part of this. Universal health coverage. But how we run universal health coverage is key. How we'll go about it, we'll either achieve it or not achieve it.
And on that note, I want to ask you this. You've heard from your fellow doctors about what is available, what is possible, either at their county for the Dr. Anset or at the largest referral hospital in the region for Dr. Kamuri. Does that resonate with what the doctors who work there tell you as the union? Are the doctors there telling you, yes, we have medical cover, yes, we have access to PPEs?
I'll respond to that.
From both the county level and even at KNH?
Yes.
Is that what they're telling you?
I'll respond to that. And one, let me start with KNH. You know, I have a contract here. And I think I sent it to you, so you have it. And
I haven't verified it. So
but that contract is from KNH. And it says you will be covered in the hospital general wards. So, and there's a story that happened, sad story, of a registrar who got sick and was in the general wards and was not doing well, and he had to help out in that intervention. So I'm not talking imaginary things. I have the doctors I just received a message from a doctor who works in Othaya. Says she's not received her salary for the last 3 months. And this doctor was in the office when they came to me, and they were just asking for simple things. That we are being transferred from Othaya to KNH, would like to understand how this arrangement is going to be, how our contracts are going to be transferred. Simple, basic thing. But when you dismiss them, you don't explain to them that this will take time, we'll pay you, hold fort. When you don't do that as a manager.
Okay, and I'll give him a chance to respond.
That's what I'm saying, Wahiga. Those are real issues that need to be handled.
Okay, and I also want to give them a chance to respond. Anything from the doctors at Machakos County? He's made very strong promises here today that they are sorted. Medical cover, you name it. Is that what you're hearing from your members?
Let me clarify. NHIF, as is, even the National Comprehensive Civil Servants, cannot cover for COVID. What can cover for COVID is the compensation package, the group life, WIBA, and group personal accident cover.
Dr. Anselem is really nodding his head. I wish our viewers can see he's actually disagreeing.
I'm not talking of imaginary things. Anset can nod his head as much as he wants, but I'm telling you, and listen to this. That comprehensive that was rolled out, the worth 6.4 billion, is what can cover for COVID. As we speak, NHIF will, and they can confirm, they do not have the funds to actualize that. So our doctors are exposed, and healthcare workers are exposed. It's real.
Gentlemen, I don't know if the viewers might be left a little bit confused by all the different perspectives coming from each of you. Let me first give you a chance to respond, Dr. Kamuri, before I allow Anset as well. Then we'll take feedback. We need to look at what Kenyans are saying tonight.
Mwahiga, the problem with my colleague here is mixing issues. Mixing issues such that eventually we don't even know what we are discussing. And the problem of Kenyatta is a big body. Yeah? And when you tell me whether my workers are covered, and I tell you categorically they are covered, that's exactly what I mean. And I want to clarify here. When you come to the University of Nairobi to College of Health Sciences as a doctor on training, you don't become a Kenyatta employee. You understand? You are still either belonging to the university, you are either belonging to the county, or you have been sent. There are even others from abroad. When you come, the fact that you are doing medicine, you are learning to be a specialist in Kenyatta, does not make you my employee, because you are not in my payroll. And that's what I'm saying. When I tell you my workers are covered, I would want him to tell you how many of my workers who are not covered. When you are a registrar, you are covered by the University of Nairobi. So it is the responsibility of the university. However, as a hospital now, we extend, and that's why when he brings me an issue, I say, because he's my colleague, I will do the prerogative of a CEO and I admit him somewhere, but that is not procedural. Is the prerogative have been given. But the rule is the employees are the only ones I cover, and all my employees are covered in private wing. So let us not mix issues. The fact that you will tell me that there is one doctor in Othaya who has not been paid, and again I was telling you, if you have not been paid, it means there is a problem.
I'll need to clarify
that is true.
There is a problem.
There is a problem.
And I've told you, there is a problem. And that problem can be a system problem, and that we said. And it can be a problem because maybe you have not given documents. There is something I need to explain to you also, which again he's bringing, which is not supposed to be.
Could it be
here.
a problem that funds have simply not been remitted?
No, it is not. And I've said it is not an issue of funds. Because our salary we pay on a monthly basis, and it's not money we have. We actually ask every month to get the money from the treasury every month. However, what I'm saying is the workers we have been transiting. We are now we took over Othaya, which is we are transiting those employees from national back now to Kenyatta, because we have made Othaya a referral in Nyeri, which is part of Kenyatta now, so that they can be in one payroll. So if one worker, because of a system can fail. Every system can fail. If you have one doctor who has not been paid, that is something that can be sorted out. And it can arise in any system.
I ask you this, Dr. Kamuri, because last week on this program I had Dr. Kivutha Kibwana, Dr. Anyang' Nyong'o, two governors, who both said that what they are supposed to receive from the national government for 2 months now hadn't hit their account. So,
for me, no. Simple. For me, no. Even now, as we talk, in fact, for my hospital, I pay. By the end of the month, we pay. So,
okay, I need to allow Anselem. Do you remember you said some things about Machakos County, and I need to be fair to him as well. That's the only reason all of you will agree to come back here if I give each of you ample time. Dr. Anselem, come in. PPES, NHIF as well. Talk a bit about that. And is that the cover that you're talking about that all your workers have access to?
Yes, and if you check, I've actually forwarded to you on WhatsApp.
I'm in the middle of an interview. I can't look at anything.
No, I'm just saying for verification, so that Dr. Wachonda does not continue splitting us. But I've sent you on that, and you can confirm with your team that we have a letter from CEO NHIF, Dr. Kamuri, indicating that COVID-19, dated July, that COVID-19, they'll be able to cover, and within the government facilities, they have listed the number, including county gazetted COVID-19 treatment centers. That one is there. I've sent it to you. Then the other thing is good when Dr. Wachonda keeps on saying that the union is helping government. It's a good thing. We have a responsibility, because most of us healthcare workers, especially doctors, for those 6 or so years when we are training, actually the government of Kenya used a lot of money, public money, to train us. And therefore there is nothing wrong with us giving back to the same government, because there is a fact. We know how much you spend to train one doctor is not comparable with the fees we pay. So it's a good thing, and I appreciate the union for really coming out and supporting the government. I also want to state here clearly that Dr. Wachonda and I sit in the same committee, a national level, Human Resource for Health Committee. And most of these things that we discuss there, the problem is my colleagues from the union, their biggest issue is, I think they are so much fixated on the Health Service Commission issue. And I want to state some basic facts. Before devolution, the last time the government employed new doctors was in 2009, before devolution. Okay, obviously there's the issue of we were used, as doctors, myself included, that it was automatic. After internship, you get deployed. But I'm also a teacher of healthcare workers in our universities. And we started quite a while informing our medical students, other medical, healthcare students, that let's start thinking out of the box. The issue of being assured of employment after internship at some point will come to an end. And the reason is not because of anything else, but purely because the governments, whether national or county, resources are not limitless. And therefore, that has come to pass. But I want to state categorically that fact of the matter is devolution. Actually, the hallmark of devolution is health. And there are so many things which have happened in health since 2013 across the counties. And a lot has been achieved in health, actually more than what was there before. Dr. Wachonda might be slightly younger, but I can tell you the healthcare workers, and if we narrow down to doctors, there are times you could go, actually sometimes you could be working in the extreme corner of this country. Then you wait, you don't get your salary. Following up to know what happened could used to take you months in affairs. You could files DS used to get lost. Now all those things have been sorted. I can give you an example. Last week, but one, we were doing a suitability test for healthcare workers for promotions. And there is one healthcare worker, actually we were even able to conduct that suitability test when he was in Belgium. It has never happened when health was not involved. And therefore, because there are things which we need to be very clear about. It is an issue of taking health back to national. Let's have that discussion openly with proper public participation, including the users of those services who are the patients. And I can tell you across the country, most patients are very happy. They can be able to access health services closer to them. They can also be able to launch their complaints and compliments in institutions which are closer to them, and they are happy. So, and I'm speaking as a doctor, and a senior one for that matter in this country. Dr. Wachonda is schooled in the same university. You know what we learned. More university, but we must get real. Let's not be so selfish.
Fair enough.
Let's tell the country how the health service commission is going to help the patient in the village, in Kangundu, in Kawede, rather than just surely. And I want to say this without fear. It's okay. You had your chance to speak many times, so I have a chance to respond. Fact of the matter is,
briefly, please.
Most of our healthcare workers, including doctors, over 95%. They have no issue with their being in the counties. The few who are bringing issues are those few, and I'm talking about less than 5%, who are not comfortable with the close supervision which comes with counties. And therefore, those are the few who are marking the waters to appear like healthcare workers want to be taken back to national government. That's not the fact. So those few who don't want close supervision, that's where the problem is. Thank you.
Sure. I don't know if that's a completely fair statement, but that is your opinion. I think we need to look at that feedback now. Remember, 22422 is the SMS line, and the hashtag is Newsnight. Then I'll get some final thoughts from each of my guests. This is what you're saying. Nguringati says, government not serious and taking doctors for granted. With a lot of humility, I support the strike. Can we deploy KDF to Somalia without guns? It's a joke. So Ngure concerned about this looming strike. Trasfera says Ministry of Health should take responsibility of the welfare of nurses and doctors. Omwando Vickery says medics in Kenya must be alive to the realities of the economic depression occasioned by the pandemic. Some of the demands, especially on promotions, increased salaries, are not only blind but also outrageous. Another one here, Rotich Bram, you say health workers have genuine concerns. The government too is facing serious economic crisis due to pandemic. The two parties should engage and reach a consensus. Health workers strike at such a moment will cripple our nation. Let's give dialogue a chance. Do we have another one or two more? It's Kipletin, you're saying health workers are raising fundamental issues in regards to their comprehensive health cover, PPEs and risk allowance. It's high time government should listen to our frontline healthcare workers. All right, I'm told this is the last one. M1Billy, you say it's unfortunate that all panelists in Newsnight are doctors, but they can't agree that public health care in Kenya needs to be fixed. How can politicians understand these issues? No wonder we are hiring Cuban doctors to fix this mess, digging a hole to fix another hole. I actually want to hear from my panelists on that one. That's an interesting perspective. 22422 is the SMS line. Let's pull up those SMSs. This is what you are saying. Dhuranira Kagweria says, doctors have been employed on contract terms, some being paid on substandard terms, doctors with no medical cover. Dr Kamuri, stop defending a mistake. Let our doctors be converted to permanent and pensionable. Our KNH board is holding us ransom. To each of you doctors, remember those questions. You'll have a chance to respond to them as well. And I saw one last one here which I want to pull up. Let me read it even as we get some final thoughts. Someone here saying, Ronald Kamanza, the doctor and nurses strike is political. It has nothing to do with the welfare of doctors. That's what some Kenyans feel tonight. Different perspectives. Who do I start with? Dr. Kamuri, let me give...
You give them two a chance?
I give them two a chance. Okay,
I have to.
Go ahead. Then I'll come to Dr. Kamuri.
I'll say this. I listened to Dr. Anselem, and he's speaking from both mouths, from both sides of the mouth. And I'm saying this because in 2009, doctors were resigning out of government and moving into the private sector because the terms and conditions
He was saying that they were going...
No. Let me put it in context. So doctors were resigning. In 2011, when the union came, negotiated for better terms and conditions of work, doctors trooped back into the public sector. And this union has increased the doctor population ratio of this country because of the improvement of the terms and conditions of work through negotiations. Secondly, he cannot speak for doctors. I am in charge of 8,800 doctors in this country, in the union. He might be my senior, I respect that, but here I speak for the 8,800 doctors who engage me every day on phone, on email. So I know what I'm speaking and I know what I'm saying. And when I'm saying that we are not fixated, and that's the problem I keep telling you, that you say the union is how or what. No, these are things that have been said. Focus on the issues again.
Not how I want not the faces.
Focus on the issues. That the issue is we have a problem with how healthcare was devolved in the country, and that is a discussion we must have, and we must fix that problem.
Let me ask you this.
He is sorting, he's speaking from a side where, you have to speak from where your bread is buttered. I understand him. But in reality, he has to defend Council of Governors here today. But there are issues that are real, and follow the Senate proceedings tomorrow. Okay. And you will see, because we have evidence
Council of Governors have been summoned, yes.
on the plight of healthcare workers. So let's resolve that. Now, to my colleague here.
Briefly, please. I'll need to give them each.
To my colleague here. 16 of those doctors, and he admitted that there's some form of transition. 16 of those doctors wrote a letter to the Ministry of Health. They copied him, and they copied me because I speak again for doctors. And employment and labor relations are issues I handled. But how they've been handled is not right. And that's what I'm saying, management. How you manage the employees. Because it's not right for someone to go for 3 months without a salary, and you're talking about systems, that this system is not working here, is not working here. How do you expect them to work? So yes, you're supposed to serve humanity, but you go back home, you have a small child, you have a baby, you have a family, and most of the doctors in this country come from average Kenyan families. They are dependent on, the families are dependent on them. And secondly, the societal expectation of a doctor equally takes a toll on the doctor. And Dr. Kamuri and Anselem will attest to this. So these are issues that we must address in a manner that promotes industrial harmony, and in a manner that will ensure you will have very little grievances from the healthcare workers.
Okay. Thank you. And now I want to get final thoughts from each of you. I want to start with you, Dr. Kamuri. If you want to respond to that SMS there by Dhuranira Kagweria, even as you give us your final thoughts. 21st of December, Dr. Kamuri, a doctor strike might kick off. Nurses and clinical officers on strike as we speak. We're getting to the festive season. People are going to be traveling. For me, it sounds like a very scary situation if something doesn't change. Let's also talk solutions as you give your final thoughts.
Well, I will tell you, and it's unfortunate that we may look like we are talking different things.
At cross purposes.
Me and Wachonda, and Dhuranira is Wachonda's colleague. He's acting what? Secretary?
No, he's a branch secretary in Nairobi. You see, he doesn't.
I know, he's my worker. He works with me. He's my worker, and he's a very good worker. And he has been engaging here, making a lot of noise on me, because he thinks I'm saying contrary to what he would want me to hear. However, me and Wachonda, we are not talking differently. And we agree, and we must agree, and I must say here, we are all working for health systems to improve.
Yes.
And I've said, Wahinya, even as COVID has come, and he said it has exposed us to learn that we had so many gaps, including human resource. And what we are working now, and the engagement we are getting, is to make sure the health systems improve. And we need to come together. And as I've said, and I will go back, pandemic will come and go. Swine flu was here. The other Spanish flu was here. But it went. But what must we remember? We must remember that we must make our health systems better today, so that in the event, there will still be another pandemic. I can tell you for a fact. Me and him, he can tell you. Even now, as I speak and as we sit, we have models of what will happen to this pandemic. It will come and go. However, how will we be left? Will we be left with Wachonda fighting here? No. We are saying, let's go back together. Let's sit down. Let's discuss. What is low hanging fruit? We pull the fruit. We eat together. What is not workable? We look at modalities. Both in the national government, in the county government, and even in the semi-autonomous government agencies like the one I run. So we must come together as stakeholders, so that for us, at the end of it all, and I repeat, at the end of it all, whether we are discussing here or what, Wanjiko must be left with a smile. Even when a doctor is addressing you, the end product, Wanjiko must smile. Whether you are doing what, whether you are putting systems, what ends the whole of the road? The end of the road is Wanjiko must get a smile. Whatever we do here, me and Wachonda and the gentleman in Machakos, for me, that's my dream. How we do it, it is us to decide.
I hope you will decide before the 21st. Dr. Ansent.
We will definitely, me and Wachonda.
Okay, good. Light at the end of the tunnel. Dr. Ansent, let me give you a final word. Please keep it brief.
Yeah, thank you, Waiga, Dr. Wachonda and Dr. Kamuri. Mine is to urge each one of us to give a dialogue a chance. As I said, we sit in the same human resource for the committee with Dr. Wachonda. And in fact, more of these gaps, we've identified them in that committee. And we've engaged national and also county governments to fill those gaps. So what I want to remind my brothers in the union is that like Dube sang, that somewhere between heaven and hell is where you find a real ideal freedom and all these things. But that place never exists. So it's an issue of, it's good, and I personally, I defend healthcare workers, and we have a duty to ensure that our healthcare workers get the best working conditions, favorable salaries and everything. But then let's also appreciate our economic situation. Of course, I need to clarify to my brother, Dr. Wachonda, that obviously I don't work for COG, so you can't say, but I'm defending COG. I don't work for COG. But let's be sober. Let's engage in a sober way, whether on social media, in our physical meetings, Zoom meetings, and then let's be the people who really bring sense to this field. As that person treated, if we start telling half-truths about what is happening, then what will the politicians do? We are the healthcare workers who have gotten this chance to serve either the union, in the counties, in KNH, Parasa, and so on, and we must fix the truth. Because like for the NHIF and the COVID, yes, I'll forward it to Waiga, he might confirm later, but that's the correct position. There is that letter from the CEO of the NHI that for within government facilities, they'll be able to cater for COVID-19 related ailments. So mine is to urge the unions. We've been engaging with the unions. Today we've been meeting with the nursing union and also the clinical officers union, Machakos branch. And we've also been actively, even yesterday I talked to the chairman of Law Eastern branch, Dr. Okumu, and we are engaging and we're in very good terms. But let's, as I said, let's be sober, let's discuss things for the betterment of our people. Let's appreciate that patients are really suffering.
Okay.
Yes.
Okay, thank you. I'll have to cut you off there. Chibanzi, because you've already spoken, I'm literally going to give you 10 seconds. From the time you postponed the strike, have you seen signs? Could there be light at the end of the tunnel that 21st December will not arrive before a solution has been reached? Are you hopeful?
You live with hope in this life, and we are engaging. We will engage to get a solution. And just to say that as KMPDU, our focus is on strengthening the healthcare system in this country through the human resources for health, because without the requisite numbers, technical skill for health, then we will not have healthcare. And to finalize, the Human Resources for Health Protocol and Guidelines that we developed together with Dr. Anselem Kituku at the Ministry of Health National Task Force has very good recommendations, but it is not being implemented, even in the counties, and we have a problem there. The decisions out of that committee, the recommendations, the final decisions are being made at a much higher level, in which some of those recommendations are now being taken seriously. And lastly, the doctors that were sent to the counties covered their shortages. Instead of letting them work in isolation treatment centers, they sent them to cover their shortages in maternity units, and we have a problem. So let us admit that we have a shortage. It is something that is doable with the political will that is required. Health in itself, we can talk here as doctors, but if our political leadership does not listen and take that direction and say we will fix health, because COVID-19 has given us the opportunity to, one, strengthen the healthcare system,
yes,
two, achieve universal health coverage. Thank you.
Thank you. I was going to say finally, but thank you for that. Let me read one last 2 SMSs here. One from, I believe he was the previous holder of the seat you hold now, Dr. Uma Oluga. He says, COVID-19 has caused so much pain amongst Kenyans as it has in the world. Healthcare workers have borne the brunt of it. People have lost jobs, lives, etc. Times are tough for people. The times are even tougher for health workers who must go to work in difficult circumstances. He then goes on to say, no amount of resources can be enough during the pandemic. Even in the US, nurses complain of the lack of quality PPEs. In Italy, Germany, UK, the same thing. All over the world. It's a long message. I can't read all of it, but he says, we must decide what we want left after the COVID-19 pandemic. It will take more than government to solve the problem. Let us stay safe, follow regulations. And like Ansent, I submit that a health service commission will bring equity, standards and security to health workers across the country. And Senator Sylvia Kasanga has questioned, you mean we have degree workers, holders applying for positions for certificate holders? That is significant. Those are some of your messages. I'm getting others. We don't have time to read them all. Let me begin, or wind up rather, by thanking all my guests joining us virtually. Dr. Anselem Kituku, CEC Health, Machakos County. Here in studio, we've had Dr. Evanson Kamuri, CEO, Kenyatta National Hospital, which is a semi-autonomous institution under the Ministry of Health. And also, a man who's been on the screens quite a bit in the last couple of weeks, Dr. Evanson Wachonda, Secretary General, KMPDU. You say tomorrow, I'll focus on Senate. We'll be covering that here at Citizen TV. And thank you for everyone who sent us questions, comments, feedback. And sorry we couldn't read all of it, but thank you for tuning in. And of course, here at Citizen TV, we endeavor to have these conversations that are very important to you and to get the right stakeholders to answer the questions that you may have. And on behalf of the whole team that's made this broadcast possible, let me say thank you. My sign language interpreter has been Yulan Zale. My name is Wahiga Mora. Stay safe wherever you are. And we definitely hope that the health stakeholders will sort these issues, because we can't imagine another strike on the 21st of December, even as we are hoping for a resolution to the strike by the nurses and clinical officers going on as we speak. Stay safe wherever you're watching this program from, and have a good night.